Hello, everyone. I think we're ready to start. I'm very happy to see all of you here this morning. I want to point out to you first that there will be interpretation in the languages of French, Spanish, and Arabic, and you can find them under the globe at the bottom of your screen. My name is Emily Vargas Barón, and I direct the RISE Institute, where we work to advance early childhood development, early childhood intervention, and nurturing care. We really prioritize assisting countries to develop effective multisectoral ECD monitoring and evaluation systems. That is the topic for our day. On behalf of UNICEF, WHO, and the RISE Institute, I'm delighted to welcome you today to this very important webinar, Applying the Nurturing Care Framework to Multisectoral Monitoring and Evaluation Systems for Early Childhood Development. Thousands of people in all countries are working diligently to attain the Sustainable Development Goals. To measure SDG progress at national, regional, and global levels, key performance indicators have been carefully developed, tested, and approved. Furthermore, major efforts are moving forward to identify more and better indicators to measure the ECD achievements in all countries and to ensure we include all children and families. As you know, just a second here. As you know, our multisectoral field of early childhood development presents many very big challenges for establishing multisectoral data systems, as well as selecting indicators, choosing measures, and gathering, analyzing, and reporting on data. Several countries have already developed effective systems of multisectoral ECD monitoring and evaluation, and they are yielding useful data for the annual preparation of ECD and ECI programs and budgets. In addition, data dashboards and portals are being increasingly developed in various world areas. However, we are aware that currently many countries are still in the beginning stages of developing their systems, and some have not yet begun. The Nurturing Care Framework gives us a very important structure for planning future comprehensive multisectoral data systems country by country. Today's webinar will help each of us to reflect on the status of our country in developing a robust multisectoral ECD monitoring and evaluation system. It will also give us additional information about valuable resources that could help us with our data development projects. I am delighted to introduce our two speakers. Representing the United Nations Children's Fund, UNICEF, will be Morifas Kakabwe, PhD, who is an early childhood development expert with over 20 years of experience at global, regional, and country levels. He currently serves as an ECD specialist at UNICEF headquarters in New York, providing leadership on nurturing care, ECD financing, and partnerships. Previously, Dr. Kakabwe managed child development programs in Eastern, Western, and Southern Africa. Before joining UNICEF in 2012, he coordinated child development, humanitarian, and livelihoods programs at Save the Children and the United Nations Development Program, UNDP. He is passionate about creating strong and sustainable global, national, and family systems for achieving improved child and human development outcomes. Representing the World Health Organization will be Sheila Manji. She is an ECI expert with WHO, working at their headquarters in Geneva, Switzerland. Her experience spans multiple sectors and includes support to governments, communities, UN agencies, and philanthropic and civil society organizations. She is dedicated to developing contextually appropriate solutions that enable children to thrive. In WHO, WHO, her areas of work, including supporting the implementation of the Nurturing Care Framework and working with partners to develop advocacy and operational materials that can advance attention to and investment in early childhood development. She also works to strengthen health systems to provide care that will be of high quality for caregivers and their young children. I would like to note to you that we have a question and answers section down at the bottom of your screens. When you think of questions that you would like to ask our speakers, please place them in the Q&A section at the bottom of your screen rather than in the chat section. Our first speaker will be Dr. Boniface Kakobwe from UNICEF. Boniface?
Thank you very much, Emily. Good morning, good afternoon, good evening, wherever you are. We are honored to be part of this conversation today, and we appreciate for getting the time that you can join this conversation. As you have heard, I'll be co-presenting together with Sheila from WHO. Sheila, next slide. So in the next few minutes, we are going to focus on these 4 areas, core elements of nurturing care framework. We know some of you are already aware of the framework, but to touch on it a little bit, and also focus on what do we need to monitor. As you are aware, we are focusing on monitoring and evaluation in this conversation. And again, what are we learning? So there are some other things that we are seeing in the field. We also spend some time discussing that. And we end by the way forward after the conversation to say what's next. So this is the outline of our conversation today. The nurturing care framework, as some of you also are aware, was launched, at the 71st, World Health Assembly in 2018. So the journey started in 2018, and there's a lot that has happened. But the framework itself is a roadmap that outlines 3 things. 1, why efforts must begin in the earliest years, from pregnancy to age 3. And I'm underlining pregnancy because sometimes the word there, we think, we take it that is from birth, but the framework pushes us back to pregnancy. So pregnancy to age 3. And also how nurturing care protects children from the worst effects of diversity. That's also something that, is outlined in the framework. And what caregivers need in order to provide nurturing care. And that's critical because if caregivers are not fully supported, they may not provide the nurturing care that we require. So that's the page, the graphic of the framework itself. I think the majority of us are familiar with it. But again, also what children need to develop. Children need a lot of things to develop. But on the left, you see the policy systems and the data systems. So children need we need good policies. We need also to provide the services, and we need data systems that are also there to help, to ensure that children are actually developing. Then now, when you move, you see the familiar graphic of, the nurturing care components of nurturing care, where you see now the good health, the adequate nutrition, responsive caregiving, safety and security, opportunities for early learning. So these are the 5 components of nurturing care. At the same time, as children require those 5 components, we also need now environments that support children's development. So we need caregiver capacities, we need empowered communities, we need supportive services, and we need enabling policies. So all that is what children need for them to develop to their full potential. So once we do that, children are now going to be developmentally on track. So that's now an output level, outcome level. We need those elements of nurturing care. We need the support systems. We need the policies so that the children are developmentally on track. So that's what children need for them to develop. You may not see much of this, but don't worry, because I'm going to expand in the next slide. But suffice to say, on the right, we have 24 indicators. You may not read as I indicated, but these 24 indicators are not even actually new, but they were already there, existing indicators. But we picked now those indicators to say if we are to report, in SDG reporting, and even at population level, for the data required in countries, these are the 24 indicators that were identified to help us, report the SDGs. But as I indicated, I'm going to expand. Now we need the inputs, we need the outputs, we need the outcome, and we need the impact. So this is the framework that we have so that children are developmentally on track. If I go to the next slide, Sheila, then I can expand. So I talked that I'm going to dwell much on this. So we have the abbreviated nurturing care framework logic model. Now, in this model, you see down there, enabling environments for nurturing care created by the policies, programs, and services. You recall I indicated that we need good policies, we need sound programs, we need the actual services. So that's the enabling environment that we have. Then as you go up there now, you also need the government leadership, empowered communities and families, strengthen systems for delivering programs and evidence. And the systems in this context is very paramount because, as we know, child development is so multisectoral and so integrated that one sector cannot do it all. So we need systems that are so strong and speaking to each other so that we deliver programs and also the evidence that is required. And again, communities, because these are the custodians and the families. Children grow and develop in families. So we also need to have families that are so empowered. And the government leadership. In all the countries, we need the government, political will and the leadership, the governance systems, so that the program can be well implemented and even designed. Going up there, we see the 5, strategic actions for the national care framework: the read and invest, focus on families, strengthen services, monitor progress, and use data, and also innovate. Then once we do that, we move up now to outcome level with the components of nurturing care, the good health, and the 5 that I mentioned, at outcome level. But once now the children get that, the 5 components of nurturing care, then we move now to the desired impact. So every child is able to develop to their full potential, and no child is left behind. And allow me to underline those words. Every child. So we are not leaving any other child behind, but all the children, in respect of their situation, wherever they are, they need to develop their full potential and don't need to leave any child behind. And also the children should be developmentally on track. As we know, that's the desire, the dream, that by 2030, all boys and girls should be developmentally on track. So this is the abbreviated nurturing care framework logic model, which is summarized as I have elaborated. Now, from 2018 to now, we have moved now on a journey to say we need to track, we need to monitor, we need to evaluate. So WHO, UNICEF, World Bank, and others, we have been working collaboratively to develop instruments. And these instruments, we are answering this question: are children developmentally on track? So the aspiration is by 2030, children to be developmentally on track. But are they now reaching that developmental milestone that we desire? So these instruments are meant to help to measure at population level, but also at the program level. So view these 3 elements, 3 tools to measure at population level and even at program level. So we have the global skills for air development, which you see there, the 0 to 35 months, thanks to WHO for the leadership on this. And we also have the ECD 2030, that's the Child Development Index, popularly known as ECD 2030, where we are also measuring from 24 months to 59 months. And again, thanks to the World Bank, the AIMS ECD, 48 to 83 months. Somebody may say, why the age overlap? Because efforts are to ensure that we don't leave any child across the spectrum, but these instruments speak to each other, and there's also work in progress so that we synchronize the age overlap. Let's move on, Sheila. Thank you. You might have heard of the countdown to 2030. These are the profiles for ECD. So these profiles include data that is available in multiple countries, and good to say that it's also comparable. Same questions, same survey methodology, and in each country. This is rare because to have standardized the tool like that, and we are privileged that we have the profiles so that we can have data that is comparable. And where do we get the data to do that analysis? The UNICEF multiple in their indicator cluster survey, the mix, the USID demographic and health surveys, the DHS is a source of information. the country data published in high impact journals. We also use that data, definitions, dates, and the countries for which data are available, and also can have the technical index. So the profiles are available, and it looks like that on my right. So you are welcomed by that page. Then you can navigate depending on where you are. If you're in a country X, you drill down and you go to your country, then you're going to see all the profiles for your country. So in the next slide, I'm going to dive into in a bit. So the profiles gives you 40 indicators. We have 40 indicators. So we have 4 indicators on demographics. The rest to ECD, there are 8. Then we also have outcome or impact indicators. There's 205 to 2015 trend in children at risk, the gender and race-based differences, the children developmentally on track. So in the profiles, you can actually check to say, in my country, what's the proportion of children who are developmentally on track, the ECDI, you can also check there, and children with the functional difficulties. So outcome level, that's what we are tracking at this stage. And again, the 5 components of nurturing care I indicated earlier on. So health has 4 indicators, nutrition has 3, the safety and security has 4, early learning has 4, and you may be wondering why to be developed, on responsive caregiving, work is already happening. So we know the gap. When you go to that page, you see there's always a question mark on the responsive caregiving, but we are defining that, so we should be able to finalize soon. So look out to that. Once we finalize, then we also have the indicator for responsive caregiving. Then we have 9 indicators of facilitating environment. For policies, we have 5, and international conventions, we have 4. So all I have been explaining in terms of the number of indicators, for environment, for components of nurturing care, for outcomes, demographics, is what you see on my left. So I'm not going to deep dive now, but we just want to highlight that this exists, and you can go to the profiles and you can get the details where your country is. At this stage, allow me to pass the mic to my colleague Sheila to take us through the next slides. Over to you, Sheila. Thank you.
Thanks, Boniface. So as you can see, we're doing a little bit of signposting on what is already available that can support you with your efforts, but also pointing towards things that are underway. So this image here is really taking us through, all the different levels that we need to be thinking about, because while our ultimate goal is our children developmentally on track, and for that we now have some impact measures to help us understand and address that question. We also need to be thinking about continuous data collection, continuous monitoring, continuous utilization, and thinking through at all these levels, from policy, provision, quality, utilization, and coverage. And so a set of indicators are still under development. They're still thinking around what needs to go into these. But as you'll see, there are some countries that have already started to think about this and pull this together into an M&E framework. So after the framework was launched in 2018, in 2019, we produced a concept note on what it would mean to monitor implementation of the framework. And it doesn't give you the answers. It's giving you food for thought. It's reminding you that we have the strategic actions and we have the 5 components of nurturing care. So any framework that is developed needs to consider the 5 strategic actions as well as the 5 components of nurturing care. And as Emily said at the very beginning, early childhood development is quite complex. It isn't sitting neatly in any single sector. It's not a single intervention. So really thinking through the multisectorality as this comes together. It also speaks to the importance, as Boniface was mentioning, of leaving no child behind. So as you think about those 2 circles that Boniface showed us, the green concentric circles and the components of nurturing care, there's also a third one, which has the triangles and talks about what we do in universal services for all children, but also services that might be more targeted or indicated depending on the needs of children and their families. So I'd encourage, if you haven't seen it already, to go take a look at this one. It gives you a sense of what are some guiding principles to help you as you're thinking through developing M&E systems or M&E frameworks. and then also outlines what we are working towards. I'll caveat that some of the information in there is already a little bit out of date in terms of some of the timelines that were set, because as you heard from Boniface, some of that work is still underway, including defining indicators for some of the newer elements. Then after that concept note, we released the Nurturing Care Handbook, which has a guide for each of the 5 strategic actions. And so this is the one for Monitor Progress, Strategic Action 4, where we look at population monitoring, implementation monitoring, as well as individual children's development. And in each of those, we provide some suggested actions. We look at typical barriers that are faced, and provide guidance or signs of progress of how do you know that you're moving in the right direction. But really what we're trying to understand when it comes to that implementation level is, are we doing what we plan to do? And does this lead us to the expected results? So if our end goal is that children are developmentally on track, the data that we are collecting at that implementation level should help us understand what are the things that we are doing or need to do more of in order to get closer to our goal. In 2023, we did a progress report, a 5-year progress report looking at implementation of the framework. And from that generated some recommendations on what to focus on going forward. And so this is the high-level summary of those recommendations by the strategic actions. And if I focus in on the monitor progress on the second row in the middle, you can see there are 2 recommendations there. So the first one really about using data to inform planning, budgeting, and programming. I think a lot of data is being collected, while within sectors, for sure, a lot is being collected. It may not be coming together just yet, and it may not be being used. There may not be processes in place to use that data or analyze that data and make decisions based on that data. But this also includes making decisions around things that might be missing. So we know, for example, Boniface mentioned we need to define indicators for responsive caregiving. We could also say the same for caregiver well-being, and better understand, what are the newer indicators that might be needed in our systems. And the second one around individual and collective impact, that's really recommending utilization of the tools that Boniface mentioned, so the GSED and the ECDI 2030, to really understand how all the work that we are doing all along the way is actually making a difference. So it's a recommendation to incorporate these tools into our population level surveys and other means at programmatic level. And so the reality is, because ECD is so complex, and because it does span so many different interventions in so many different sectors, it's impossible to have just a sector-specific framework. You need to know what data you need in your sector, but we also need to be thinking across sectors. And so it will take a whole of government, whole of society approach, and our data systems usually are not set up that way. So let's see what's happened in countries for the moment. And these are just illustrative examples. As you heard from Emily at the beginning, some countries are well on their way, others are just getting started, and others have not yet started. So one of the biggest things we have seen in the most recent years, particularly as these tools have come out, is the integration of these measures of child development as part of national surveys and cross-comparable surveys across the different countries. And as you saw, that's a recommendation that's come out of the progress report also. And we definitely need that, because if we're not measuring this, then it's difficult for us to know how our children are doing, and to use that information to advocate for better services, policies for the children and their families. We've seen a lot of policy development. There were policies before the framework. There were even probably some multisectoral policies, but a lot of new policies developed, as well as updating of policies to align them to the Nurturing Care framework. And then with that, we've also seen some efforts to develop M&E frameworks that accompany the multisectoral policy. And usually what that has meant is that they have looked at defining indicators, defining roles and responsibilities, looking at indicators across the strategic actions, as well as indicators that fall into those 5 components of nurturing care. In the early days, when the framework came out, there was these questions that were coming up around, well, what new indicators do we need, particularly in the health sector? Because if the health sector is thinking about the 5 components, they have many existing indicators when it comes to health and nutrition. But what about the other 3 components of nurturing care? And there was quite a lot happening, particularly in sub-Saharan Africa, to think about what would be new indicators that could be integrated. And so this is an example of some of the ones we've seen where one is that, child development wasn't really being measured in services, in programs. There wasn't any way to see if that was even happening. And so these indicators have been added to the HMIS. So you have the proportion of children under 5 monitored, number of children assessed or monitored, number of children referred for further assessment because of a suspected delay or disability. These, at the moment, tell you the count. They tell you how many times somebody was assessed. They don't tell you then utilization of subsequent services, the referral pathways. They don't tell you what the need is or the issue is, if there is one. So it's a step in the right direction. It's making sure that a certain service that wasn't there before is being provided, but it would need to go further for us to be able to really use that information to understand what is the nature of the support that is provided after something like this is done. And this is the latest that we're seeing is countries that are saying, okay, we've defined the indicators that are of interest to us at the different levels and across the different sectors, but we need a way to bring this together and see it together as a whole. And so there's attempts now to try and create scorecards or dashboards where you can visually see how we are moving on a composite set of indicators. And maybe using a traffic light system of a red, green, yellow to say, okay, this is where we are, this is where we need. But really trying to say, okay, it's not enough just for us to have our individual indicators, which then sit in our individual monitoring systems, but we need something that can bring them together and allow us to see them as a composite. So as we move forward, these multisectoral M&E frameworks, I think we're going to see more and more of them, and we do need them because we do need to know what it is that we are monitoring continuously to move us in that right direction. But there needs to be agreement in country on what the targets are. What are the changes we're trying to make? And some of those targets would be coming from the SDGs. We need to better understand what each sector is responsible for. So which indicators are coming from which MISs, and if needed, if there are new indicators, where are they going and who's responsible for that? Agreement on the indicators is part of the puzzle, but then we also need to make sure that we have the right tools to capture that information and bring it together. We have many information management systems, and then we all know we have the education one, we have a health one, and et cetera, but the challenge is that only the people that have access to those ones can see them. So if I'm in health, I can see my health MIS, but I don't have access to the one in education. And so if we want to see the whole picture, we need a way for the systems to talk to each other or be connected to each other in some way. That could be that there's an umbrella system through which you could pull out the relevant indicators that you are looking for. We might need policies that allow for data sharing. And we need maybe dashboards or scorecards or some other way to be able to pull the information together at the right time, at the right place. And I would say here that, we have to think about who needs access to the systems. Sometimes they're only accessible to people working at national level, but in countries where there's decentralization, we would also want to consider what is information that would be needed at lower levels for decisions to be made. And so this requires coordination mechanisms, coordination at multiple levels and across multiple sectors and stakeholders. A lot of data is being gathered, and as M&E frameworks are developed, it could help to define which indicators are really needed. Is there duplication potentially? Maybe missing information, but really streamline those efforts. But it's not enough to just collect the data. We also need to think about how we are using that data. So these coordination mechanisms can also support joint review, joint analysis of that data and inform annual budgeting, annual programs, sector plans, and future iterations of the multisectoral plans or policies. Now, a lot of this work is happening through existing national technical working groups for ECD, the platforms where the policies were developed, and then the M&E frameworks coming from that. And so there are some people that are part of that process that have expertise in M&E, but not always, and certainly not with the national statistical officers or the planners or other individuals that are working more with the data. And so there needs to be greater involvement of those kinds of individuals in these processes. And then, as I said earlier, some greater attention to how data flows. Sometimes what we hear is, from the facility level, let's say data is sent all the way up and it never comes back down again. And so the people that are making decisions are very far away from the people that are implementing services and interacting with families. And so some aspect of flow of information up and down vertically as well as horizontally, and particularly at the different stages where decisions are made. So recognizing that changes in different countries. So before I close, I wanted to just remind you of the Nurturing Care website, but also show you a section of the website that might be of interest to you. So I'm going to try and flip to the Nurturing Care website if I can. All right, so on the Nurturing Care website, we have the country section and country experience. And that's where I am right now. The country experience page then has the 5 strategic actions, where you can click on each of these to access the handbook, the guide, the Nurturing Care handbook, as well as examples and key resources. So if I flip to the strategic action 4, here are examples of things that are underway in different countries. It's not exhaustive, and we would very much welcome your contributions. If there are experiences that you are able to share from countries that you are involved in, we would love to add them here. The concept note that I mentioned, the guidance, the one from 2019 is here. You'll also see some of the work that's underway for assessing responsive caregiving and early learning, as well as more of the recent reports. You have also access to the 3 tools that Boniface mentioned, as well as the guide on monitor progress. So I would encourage you to take a look at this. It's sort of a one-stop shop where all the different pieces that we've talked about today are available. But again, if you need to see the logic model and indicators, then you would want to go back to the framework to find that there, or they're also in the guidance note also. So I think with that, I will stop and hand it back to you, Emily. Thank you.
Thank you very much, Sheila and Boniface. Those were excellent presentations, very clear, and I hope everyone will go to the resources that you have listed today. I want to really congratulate both of your institutions, UNICEF and WHO, for the tremendous effort you have made and the progress that has been achieved. At the same time, there's a lot to be done, and we're all very concerned that this work move forward as quickly and as well as possible. A lot of lessons have been learned. We do know how to handle a lot of the questions that were posed by Sheila in her last part of her presentation, but they depend on assessing the resources and the structures and the policies in each country, and then building on what exists, creating from the base a very secure and well-rounded approach to monitoring and evaluation, and then be eternal learners to realize that we're all learning from each other and we're moving forward, hopefully together. Let me look to see if we have some questions. I think we do. Let's see. Mr. Muhammad Hassan writes, from experience, it is seen that if head of the state country is willing, coordination among ministries works well. Who should do this to motivate? Boniface, would you like to take that question?
Yeah, I missed a bit of that. Can you just repeat, Ebina?
Excuse me?
I missed part 2 of the question. Can you repeat?
Oh, sure. From experience, it is seen that if the head of the state or country is willing, in other words, a president or prime minister, coordination amongst ministries works well. Who should do this to motivate probably the head of the country to promote collaboration at the ministerial level?
Yeah, thanks, Emily, and thanks, colleagues, the colleague who has posted the question. And it's also in line with what we are learning out there from the field. He's right, or she is right, to say when we have, the push coming from the State House or the prime ministers, we see a lot of momentum. But for that to happen, some background work has to take place. So some advocacy informed by evidence has to take place. So what we have learned and what we are seeing out there is when ECD or when child development is positioned as part of the broader economic development agenda of a country, that's when it finds space now to find the senior leadership taking on board. So the countries where we have seen, even in terms of governance, to see ECD being positioned in terms of coordination in the prime minister's office or in the president's office, it takes it to be part of the broader conversation. Once ECD is not included in that strategic framework, it's very difficult for governments to prioritize. So that's why I indicated that we need some background work and colleagues on the call and institutions on the call. That's why we need to support the line ministries in the respective countries to support that kind of advocacy, bring in evidence so that they see that by investing $1, for example, the country is going to benefit by such an amount. So we have seen a lot of countries now doing investment cases, and that has ended up, seeing that kind of change and that kind of movement. But I want to agree that yes, once we have the prime minister and the presidency, leading, it works. But it doesn't just happen like that. There's supposed to be a lot of work. That's why the governance structures that Sheila mentioned is very paramount, so that we can influence the systems. And in our view, that's the way to go. Not that the land ministers cannot do it alone. They can do it, but there's a limit. So once we need the senior leadership to drive the agenda, then we can see things changing. Thank you.
Thank you. Sheila, would you like to add to those points?
No, just want to recognize the contributions coming from the chat, which are speaking my mind. So definitely your first ladies, your parliamentarians, your senior people in government. If you can get their buy-in, then that will facilitate coordination.
Yes, there are many, many ways that one can do this. This is part of the need to study the governance system in each country, because each country is so different. In some cases, it can be a lead ministry that promotes collaboration and builds the structure. The creation of organizational systems, such as councils for early childhood development, that place a strong emphasis on monitoring and evaluation and help to promote the kinds of intersectoral agreements that must be made, can be done. However, in some countries, that is not the way to go. It is very helpful to have leadership from the president, but there are other ways to move, even in those countries where there is little hope of presidential or prime minister leadership. Let's see, we have another question here. When we talk about early childhood care and education, how can this department, or the Department of Health, support the education system in bringing this reform of early childhood development? Well, that's a very interesting question. Sheila.
It's a very good question. Appreciate this. It's food for thought, and I think a lot of us will have different experiences to share on this, but it's really speaking to that relationship between the health system and the education system. And if I read it correctly, it's thinking about, if a child is going to preschool or a nursery or a daycare, that is perhaps in the mandate of the Ministry of Education, but what is the role of the Ministry of Health vis-a-vis those settings and what could be done? I think what comes to mind right away is those settings are a platform where you can identify if there are children that need additional need. or additional support. There are linkages or examples of linkages where health workers go to these early learning settings and provide immunization, growth monitoring, but also can assess for malnutrition, perhaps also assess for additional needs, and then link those children and their families back to health services. I think that because with the early learning settings, you have the children for the bulk of the day. With the health systems, they come in and out, they're there for their visit and they leave. But in the early learning settings, the workforce that is there really does see the children all the time and is there and able to pick up on things that might need further support. And so if the relationships are strong, even at the community level, if there's strong relationships between those that are teaching and those that are working at the health facility or the community health worker, a lot can be done right there to create some synergies and help people work together.
Wonderful answer. Boniface, would you like to add anything to that?
Yeah, thanks, Sheila. You recall we mentioned, during the presentation, the importance of having strong policies. So most of the policies out there, what we see is they define the roles and the responsibilities of each sector. But we need to go beyond defining it in the policies. So we see a gap that, yes, the policies may be there, might have defined the role of the different sectors, but in practice, we still see in some pockets where the ministries are not fully coordinated. So I think the key message is, as Sheila indicated, to ensure that we enhance that kind of coordination, be it in a place where maybe you have a technical working group, you have a subcluster for child development, to ensure that all the key ministers are participating. Because if they are not part of the conversation, that's why now we see that things are happening, but it's dominant in one ministry. But if we are to really achieve child development as an outcome, even taking it to the nurturing care framework itself, the 5 components, the child needs all the 5. So we cannot afford to advance maybe 2 out of 5, but we need all the 5. But for that to happen, we need the stronger policies that are translated into reality, and also ensure that they are even getting the necessary funding, and the governance structures are pulling everybody. And that's why it goes back to the first question to say, if you have now the prime minister or the president leading, then it's very easy to pull all the ministries to ensure that the child is getting everything. So I think I can only add to that, but we see and we agree, but that's the way we recommend that we need to move forward. Thank you.
Wonderful, thank you. I'd also add a little hint that it is so helpful to ensure that there is a close collaboration, friendships, and formal written agreements amongst permanent staff, such as deputy ministers who are there forever, or others who are solid permanent secretaries, for example, that they all collaborate, and they will continue collaborating no matter what administration is leading. So that is one little way to promote long-term continuous support to essential policies and also monitoring and evaluation systems. Let's see, we have another question here from Basirat Razak Schwab. Forgive me if I mispronounce. Thank you for your presentation. How can small NGOs work to improve ECD in lower and middle income countries? And how can they collaborate with governments and bigger INGOs, international NGOs, considering the influence that these collaborations can have on influencing government participation? That's a wonderful question. Boniface, would you like to take that one first?
Yeah, thank you, Emily. Yes, it is a good question. I know the person is using the word small NGOs, but I think let me underline that every institution is equally important. And why am I saying that? Sometimes we view the international, the big NGOs, that they are the ones working more with the government, but I tend to define government as the whole system. So looking at the whole decentralized structure. So an institution could be based, in a county, in a district, somewhere, and may not have even presence at the central office, for example. But the work that is being done there, that's why I think Sheila mentioned, we need the accountabilities and the whole system approach. So for me, irrespective of the level of the organization, is appreciating that, at each and every level. We need everybody. But I also see the message, you know, in the question that sometimes the coordination also misses, you know, between the so-called big, I'm putting in the quotes, and the small organizations. But in principle, we need to work together. So irrespective of the size of the organization, irrespective of where they are, actually, I get excited because even the so-called defined as small organizations, they are the ones who are very closer to the community and the families. So even the big organizations in court, it's also high time we listen and work with those organizations because they know the cultural values, the traditional values, and they can tell us a lot. So I think for me, it's not who is doing what and where, but how much we coordinate, leverage on the resources. In that way, we are going to be efficient because, as we normally say, we cannot divide the child. The child is not for organization X, organization B, but it's for all of us. We need to work together and, you know, support the child. So that's how I view it. But maybe Sheila, you can add. Thank you.
No, I think you're right. I think this speaks to a couple comments that are coming in the chat also around, you know, is it only certain sectors or only certain types of stakeholders that need to be part of this? And the answer is no, it's all sectors, right? It isn't just health and education, it isn't just the small NGO or the big NGO. It is everyone, right? We do need people working in child protection. You do need people that are working in private sector, you know, all of this. And so the challenge and the opportunity is, how do you create mechanisms that can work on multiple levels, right? So even an NGO that's working in a community or in a district, how, as the question asks, how can they be linked to or contribute to mechanisms that might be working at a provincial or at a national level? And so I would encourage that, you know, I'm thinking out loud, but I'm thinking about, are the coordination mechanisms already present at lower levels? And if not, could they be? Right? Whether you're in a centralized or a decentralized country, I think irrespective, you know, just because you're a centralized country doesn't mean that there shouldn't be coordination mechanisms at different levels. I think those are needed. And so at different levels, what kinds of platforms exist or could exist? Sometimes there are technical working groups. Sometimes there are community meetings where different actors can come together. So what are those existing platforms that already are available at the different levels? And how could those be utilized differently to bring some of these issues together and connect the different types of stakeholders and sectors together?
Yes, I would simply add that the civil society organizations, which are NGOs and a whole host of others, academics and others that are working in society for the development of children and families, really do play an important role. But if you can get them involved and membership in the central ECD council or organizational framework that exists, then their way of channeling in recommendations and actively becoming involved in making the decisions of state can be very strong. So think of your power, think of your way in, think of how you can work together, and then you will achieve the goal that you have, because your voice is very important, as both Sheila and Boniface said. We have a question from Exner Brachman. The subnational level interaction and access to data among ECD concerned actors are key. How can it be materialized that, how can this be achieved in a centralized government system or country? Boniface?
Yes, I hear the person asking the question because he's talking of we have a centralized system, implying that maybe we don't have a strong decentralized, you know, structure to ensure that data is accessed and utilized, you know, even at lower level. But let me start from the other side. An ideal situation where you have a strong system at all levels, data need not to move just, you know, from the bottom up, but no feedback coming back. So we see a lot of data being collected, analyzed at central level, but rarely do we see now it being, you know, put in a level whereby somebody at lower level can understand. So coming back to the question, the appeal or the request, is where possible, whenever we have this, data, the language, if I have like ECDI 2030, and I take that kind of language to a community, they may not understand it, but I need to interpret. So I think my key message there is, yes, we do the analysis, but now at community level, what is required to say, when we're saying proportion of children who are developmentally on track, for example, you need to interpret that so that they understand. So for me, I think it's more of now taking data and attach it also to the program itself, because data in itself is not enough, but we need data that can also be now have been interpreted in terms of now, what does it mean in terms of interpretation or impact on programming. So I think it's that kind of thing whereby not separating data and the programming, but I hear you. But I think all efforts need to be done, even though we don't have some decentralized structures, but from the central level to find mechanisms where data or the interpretation is also done at community level so that everybody can benefit from that. So my last comment on that is doing population measures alone is not enough. We are using the word population. The population need to benefit from that. The communities need to benefit from that. That's why I think going back is going to help a lot. Thank you.
Thank you, Boniface. Sheila?
Yeah, I think I see the same thing with policy. So it's not just with data. Policies that are developed at national level, that are multisectoral policies, that have implications for how coordination happens or how services are implemented at lower levels. In some cases, what I've seen is, well, that information doesn't flow down to the subnational levels. And so there's an expectation, right, that things are going to change at different levels, but there's no process in place to support that or enable that. And so then what I've also seen in some places where people are putting in processes now to say, okay, we recognize that that's a gap. And I think the same applies then for data, right? As policies are developed, as the M&E frameworks are developed, our processes put in place, our policies put in place to enable the flow of that data up and down. And then, yes, the processes to enable reflection planning using that data. And so sometimes we don't plan for that is really what it comes down to. There's sort of an assumption that it's just going to happen. But if we can look for moments in time where we can be more systematic and intentional about the processes, that might help us.
Yes, building in the whole system of analysis, reporting, application in the annual budget and program planning. It's always somewhat overwhelming because you can develop the policy, you can develop the system, but you're a year behind because it's already been developed before. And it's the budget and program have been developed the year before. So it becomes really important to plan ahead and to get all of these elements working in a continuous process with monitoring and evaluation, of course, following up on the implementation so that you see it as a spiral that cycles through time, each year learning more and doing better. We have a question here from Donald Wertlieb. What are the advantages and risks of rights-based advocacy for moving us forward? How do the CRC, the Convention on the Rights of the Child, and the CRPD, the Convention on the Rights of Persons with Disabilities, leverage these changes? How do they leverage these changes? That's a very complex question in its formation. Let's take a whack at it. Boniface?
Thank you, Emily, and thanks for the question. I know the last part of the question is talking of how can the instruments leverage, but I'll even take it further to say the CRC, for example, is not only leveraging, but providing the framework that is meant to guide. So it's beyond leveraging. Actually, the instruments are the commitments that member states have made to say we are going to do this. And those provisions, as I indicated earlier on, they're encouraging all of us not to leave any child behind. So the example that has been given, children with disabilities, for example, could be developmental delays. And there are many children in vulnerable categories that we can list in this conversation. But the frameworks are meant to say every child has to be supported, has to be embraced. So that's why I'm going a little bit further beyond leveraging. So my appeal is to use those instruments as commitments, and we can even use those for advocacy. Commitments that governments have made, it's okay to say, this is what we have committed, this is what the world has committed, and we need to support it accordingly and implement the provisions. So Emily, I'm bringing it a little bit further beyond leveraging, but they are meant to be instruments to guide, because that's the agreement to say we need to do this, and we just have to follow, because the question is sort of rights-based, but every child has the right. So we have to ensure that, you know, they enjoy their rights. Thank you. Wonderful.
Sheila?
No, I would second what Boniface has said, and I would say it's not really the first part of the question, advantages and risks. I don't see risks at all. I think, as Boniface has said, you know, we have made these commitments and we need to follow through in those commitments. But I think it's reminding people sometimes that these commitments are there, and seeing that linkage of how this aligns with nurturing care and our expectation then of what systems are able to provide, so that children aren't left behind. And I find that with indicators, some of the work that was happening in the early days after the framework came out, and people, I still hear it actually even today, the same point gets raised of, you know, if we're not counting these children, we can't help these children. And some systems are not set up to find the children that need the most support. Right? And so repeatedly we hear this comes back from countries to say, you know, where are these children? We don't even know how many we have. We don't know how big the problem is. So how do we respond to that problem if we don't know what it is? So thinking about the indicators in a way that are going to help you better serve the children that need the most.
I think a concerted action and effort on the part of WHO, UNICEF, many other organizations, and each of us is required to begin to put into place the systems for early childhood intervention to serve children with developmental delays and disabilities, also at-risk children, in order to be able to ensure that all children have the same opportunities to reach their full potential. So if we work together and explore ways to do this country by country, I'm sure we'll gain and lead to our achieving what we want in the way of ensuring the full rights of all children and their families. Anjana Mangalagiri. While the theme of the webinar highlights the significance of multisectorality, the presentation discussion seems to be limited to education, health, and nutrition. I was thinking that myself too. That isn't really, but that is the way it may have appeared. However, sanitation and child protection are as much integral to NCF and must be taken cognizance of. I totally agree. Boniface, or no, Sheila, would you like to start with that one?
We'll give Boniface a break this time. No, I completely 100% agree, and apologies if we conveyed a message that isn't congruent to what you're exactly saying here. No, it's absolutely not just education, health, and nutrition. It's sanitation, child protection. And in many countries, actually, it is, when you think about the lead government for early childhood development, it may be social development, or it may be Ministry of Gender, right? So of course, from the beginning, there are different actors that are already brought in, but it really is all sectors. You could go even beyond. It's Ministry of Finance, Ministry of Labor, right? The planning, you know, it really is, when we say whole of society and whole of government, that's what we mean. We don't mean just 2 or 3 sectors or 2 or 3 types of stake. It is everybody, and finding ways to bring more and more people, because it's true that it can get very easily put back into a little box with just a few people around a table, but continuing to find ways to bring more people into the conversation is essential.
Excellent, and that can be done structurally in each country. Boniface?
Yeah, I agree with Sheila. If we send that message that we are leaving out the other components, that was not the intention. But as I indicated when I was running through the slides on the 5 components of nurturing care, I like the intentionality of using those 5 components, because if it was like sectors, then would have been saying, okay, one sector can only do this. But the 5 components of nurturing care are actually pushing us to say, even in responsive caregiving, it's not only one sector that can achieve that.
No.
So even safety and security is not one sector. So I think we need to look at that, the 5 components, that which sector is better positioned to support, but also others can also more like, come into the same conversation. So it's deliberately that we are not using like sectors, in that cycle, but we are looking at the 5 components of nurturing care. But the key message is all the sectors, all the thematic teams, including child protection, are relevant so that, the child can get all the necessary support. And it all depends on how governments or countries are structured. So that has to be more like, customized to how the government system is structured there. But the key message is everybody is needed. We cannot afford to leave another sector. We all need all the sectors. Thank you.
All resources need to come together, and all of us need to work hard for the families and the children that we seek to serve. I want to thank Sheila and Boniface very much for their excellent presentation, for their wonderful answers to questions, and to encourage everyone to work very hard in your countries to develop the systems and the resources and the services for families and children to the greatest extent of your abilities. Thank you so much. We were delighted to be with you today, and I wish you all a wonderful day or afternoon or evening. Bye-bye.